Mina ngama masking 50-50 because I think basasekhona abantu abagulayo, but then again even when sistopile ugqoka ama mask bakhona abantu bahleli bangawagqoki and then singababona abantu abagulayo, so ngi-confused umuntu makafuna ukuyigqoka imask makayigqoke makangafuni angayigqoki.
Ever since vele kwathiwa kune-COVID it's fine then ngaqala ngafaka imask so sekuyinto yami sengijwayele angisakhohlwa ngisho uphuma endlini.
Last nekuta mo TV ba re go na le bolwetse jo go teng ga teng monkeypox, something like that. Jaanong ke sireletsa dio tse tsotlhe.
It's either ikhona or I can understand. So like now ungasazi ukuthi melume kuphi because of now they've just said we must stop wearing mask. As in like i-COVID kula mapala seyisukile everywhere.
What is a virus and how do viruses make us sick and how can we keep ourselves safe against these viruses? Hello and welcome. I'm your host, Dr. Musa Mtombeni. Signing with us today is Nonhlanhla Nyovane. On Vital Science, we focus on understanding viruses as well as viral disease. Coming up on the program, we'll speak to a gynecologist and obstetrician who is a COVID-19 survivor about his journey fighting this virus. We'll then speak to a scientific project manager at the National Institute of Communicable Diseases about viruses and viral infections. And of course, the importance of hand washing as an effective and affordable way to prevent diseases. We'll then speak to the acting chief director, of course, about the Department of Health's government gazette and the changes that have come therefore from the virus and COVID and all the regulations that have come to follow that. Remember that you can be a part of the show by asking the guests that we'll have on any question that you have on your mind. Simply share your view with us on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. Also available on social media. Make sure that you reach out to us at SABC Vital Signs on Twitter and on Facebook. SABC Vital Signs. The show continues after this ad break. Welcome back to Vital Science. Today we're talking about viruses and of course the viral conditions that exist within our world. Now 2 years ago the first case of COVID-19 was reported in South Africa. Then weeks later the president announced a national lockdown as a number of infections began to surge and the virus started to infiltrate communities and started to come closer to home. Now we'll speak now to Dr. Matthew Mojela, a COVID survivor, about his journey of fighting this particular virus. Good day, Doc. Thank you so much for joining us.
Thank you for inviting me to your show.
Good. So here you are a couple years ago. COVID has come around. You're still going to work because you're a doctor. You work in state. You're trying. You're trying to save lives and all of that. And you start to get some symptoms of this COVID-19. Take us through that journey. What was the first time like when you got COVID?
Yeah, I got COVID 3 times. So
Sure.
I had a different experience each time I had it. I think the first time when we were getting to know the disease, we're not really familiar with what was going on. And we are aware that it was very infectious. People were getting admitted in hospital. A lot of people were also dying, colleagues amongst others. So I think for the first time around was a very scary experience for me. Second time, I had a deep vein thrombosis, a clot developed on my leg.
Sure.
So I was out for about 6 weeks from work. And then obviously that was more scary because I know of about the complications of that. Then the third time was last year in December when I had it. Now we had a different variant and it was highly infectious, but hospital admissions and death rates had gone down. Yeah, so that's basically it. Yeah.
So in all this time that you're getting these different infections with, I guess, the same virus, different things are happening each time. So with the first time, what was the first presentation that you had? Was it just a sore throat versus the second time where you had a clot in the leg?
Yeah, so the first time I had a sore throat and then I thought it was just a flu. But I'm a very active person. I like walking around. I like doing things quick. But then I had this sudden fatigue. That's when I knew something was up. And I had to just test and see what was going on. And I was positive.
So those experiences with this COVID-19 virus, take us through the second time you have this experience. Because, I mean, the first time, I think a lot of people had those similar sort of presentations where you have a sore throat, you're having a lot of sweating at night and a bit of a cough, and those are generally the symptoms a lot of people saw. But you had a different presentation for the second time where you've got this clot in your leg. What was going on in your mind now when you find yourself with a different type of presentation?
Yeah, I honestly, to be very, very honest, I was very scared. I feared for my life because, you know, you can have a pulmonary embolism, a clot in your chest. Therefore, you can just suddenly collapse and die. You know, so those are things that you fear for. And my symptoms were now different this time around. From the sore throat and fatigue the first time, the second time around, now I couldn't taste, I couldn't smell. So that's how I knew I had a problem. And then I think I'm grateful for people around me, the support structure from home, my wife, the professors that I work with, my supervisors. They were very supportive. For the 6 weeks, they checked me every single day, a phone call just to see how I was doing. Yeah.
You know, when people speak to doctors and the advent of these vaccines coming out, I'm sure you were someone that went and got a vaccine during this time. But of course, we know that infections will happen throughout. So when in this process of these 3 infections, did you get a vaccine? In 2020 December, that's when I got the first time. Okay.
Yes. So then I got my vaccine around April.
Okay.
And then after that, about 2 months later, I got the virus again. And I was due for a booster. So I couldn't get the booster shot until a month after that. And then I got the vaccine. So when I got the 3rd infection, now I was fully vaccinated. And I was more confident, of course.
Now, different viruses have got different presentations. Specifically with COVID-19, we saw, and you've explained that, you know, you had different sort of presentation each time that you had the virus. Let's talk about the treatments that you experienced with each one, because it's the same virus each time, although it did change itself here and there to give a different variant, but the treatment was different in each of the different presentations that you had. So take us through the treatments.
Yeah, so the first one was just to manage my symptoms, you know, the cough. I got some supplements as well. And the second time around, because I had a clot that had formed in my leg, I had to get anticoagulants, which are basically blood thinners. So I was on that for some time. And then the 3rd time around, it was basically like the first time. So it was just supportive care, supplements, symptom relief, basically.
Now, there has been new regulations that have come out that suggest that, you know, masks are things that we don't necessarily have to use anymore. They're no longer mandatory. Your take on not having masks mandatory, specifically after having COVID 3 times?
Yeah. So I think the trickiest thing about COVID-19 was the fact that we didn't understand it. So we have had time, we have had numbers, we have had dedicated researchers that spend time, countless hours trying to figure out what is going on. And the stats that we see, or the daily stats that we have seen that the numbers have definitely gone down. And the mask, we haven't been using a mask for about 3 weeks now, if I'm not mistaken. And we have seen that the numbers are still less than 800 since we stopped masks. So it means we have definitely acquired a herd immunity. Number 2, it means even the current variant now is not as severe in terms of making people sick or killing people. And we need to start slowly going back to what we used to call the norm. So I personally think it's a great move in that direction. However, people should still maintain social distancing like we are. We should still do hand sanitizing as well. Yeah.
Has that changed your view? I mean, getting the virus 3 times or just viruses in general, what COVID has done, has that changed your view on how you view mask wearing and hand washing and social interactions between people? Because a lot of people argue the point that during COVID, because of the continuous hand washing and the social distancing and people wearing masks, they were not getting infected with flus and weren't getting the run-of-the-mill colds that they would have generally have gotten. Has this changed your behavior, even within a hospital environment, to how you interact with patients and colleagues?
Yeah, definitely it has, you know, because I know there was one time where almost 50% of us as registrars in the University of Pretoria Second were all sick. So obviously now when you interact with your patients, it's a very different ball game altogether since the introduction of COVID-19. And I think even going forward, we need to have ways in which we can be ready for this kind of pandemics. Yeah. Yeah.
All right. Look, Doc, I think it's such a privilege to have you here because you come and you speak from the perspective of someone that has gotten infected, someone that has been someone that, experienced what viruses can do, not once, not twice, but actually 3 times. But also the other perspective where you've seen what viruses can actually do, working as a doctor, being in the ward, seeing what patients actually experience when they get different kinds of viruses, and specifically in your case, speaking to COVID-19. So thank you so much for joining us today and really outlining what that journey was like for you. After the break, we will speak to another doctor, Dr. Janelle Biman, a scientific project manager at the National Institute of Communicable Diseases, about the virus as well as viral infections. And of course, the importance of hand washing as an effective and affordable way to prevent diseases. Stay with us. Welcome back to Vital Science. I'm Dr. Musamtombeni. And namhlanje sikhuluma ngama-virus. Ama-virus nenhlobo zayo khona nokuthi wena ekhaya ungayivikela kanjani ngokuthi ungayitholi le virus. Now, just as South Africans thought they were getting a break from all the mask wearing, a new virus has reportedly emerged in South Africa known as monkeypox. During the pandemic, many of us felt our stress levels rise and, of course, get more anxious every time we heard the word virus. But do we understand what the function is and what they actually do? Well, we're joined by Dr. Janelle Biman, a scientific project manager at the National Institute of Communicable Diseases. Thank you so much, Doc, for joining us.
Thank you so much for having me on the show.
Good. So today we're talking about viruses, and I think it's important to highlight and really ask the most basic of these questions about what a virus is and how we get infected with viruses. Kate, take us through that.
So a virus is an infectious parasite, if we just want to simplify it to 2 basic terms. So infectious means that it can come into your body and it can infect you. Parasite means that it takes something from you, and it doesn't necessarily have to be something drastic like taking your life. It can take just a little bit of energy or just a little bit of resources from you. So that's what a virus really is. And to be honest with you, most viruses that we live with don't cause us any harm, really. We live happily with them. We don't even know we're infected with them. And there's only a handful or more than a handful of viruses that really cause us harm. And those ones, in essence, haven't learned to live with us. Sorry, and then the next part of the question was how they infect us. Yeah, so it's a very broad question for many different types of viruses. But basically, they use little attachment proteins that are on the outside of them to bind to our cells. And then by binding to those cells, they then can gain entry into the cell. So if that answers it, but it's very generalizable, and different viruses infect different cells. So I hope that kind of explains in a nice overview kind of way.
I think it does. But, viruses aren't these scary things that, happen to find us at chance. I think viruses are these organisms that exist and we find ubiquitously in the environment. They're everywhere. But why do certain viruses have an effect on humans and others don't?
So I think it's about how long a virus has been living with us. So obviously viruses that have been infecting a particular host, for example, humans, for a longer time, they've evolved to be able to live harmoniously with us. Whereas viruses that have entered into our zones, into our comfort areas more recently, they might not necessarily have been adapted to live harmoniously with us. I hope that makes sense. So the whole thing about a virus is that it is dependent on its host to replicate and to continue living. So if it kills its host, it's actually in the long run not a good thing for the virus. So that's really, if I can sum it up, my interpretation of why some viruses cause harm and others don't. They haven't had enough of a chance to learn how to not cause us harm and how to live harmoniously with us.
Now, for most viruses, they all have their different properties on how they'd make us sick. But generally, what is the the pathology that goes into getting sick from a virus? What are the steps that happen in our bodies that will end up having a symptomatic sort of picture for the patient?
So generally, when you get infected with a virus that causes some kind of disease, whether it's just a mild disease or something that results in hospitalization, generally your body wants to make a response to that virus. So it recognizes that this is something foreign, and pretty soon after you're infected, your body starts to try to do something about it. And typically the first sign would be a headache, maybe some body pains, some fever sometimes, and then it would progress. Then it would progress depending on which virus you were infected with. So if you had a respiratory virus, you might develop, a congestion, snotty nose. You might develop a sore throat. If you had something that infected you through the blood, you might have more systemic effects. But yeah, it's different depending on which virus you're infected with. But typically, you can tell that you've been infected with something strange, something foreign, by you feeling a little bit off, even if it's just a headache, maybe even feelings of thirst, dehydration, that kind of thing. It's all your body kind of giving you clues that there's something else it's dealing with.
So what are some of the common viruses that we find in South Africa that either give us mild sort of symptomatology and those that are obviously very that are very deadly, for lack of a better expression?
Well, I'll say that even within viruses that give severe disease, there's always a spectrum. So there's always people who would have, kind of more milder outcomes and those who would have more severe outcomes. And typically it's based on what other factors that person might be having. So for example, with COVID, because we're all so familiar with it, most of our population who are infected with COVID, we don't even know we've had the virus. We don't even know that we've been sick with it. But then there are people who have, for example, comorbidities like obesity. There are older folk. There are people who have immune complications that in those people, it ends up being a little bit more severe. So it's not necessarily that all viruses that are causing severe disease don't also cause mild disease in the same population. I hope that explains or answers that question.
I think it does make sense, but something that I think needs to be highlighted is the fact that, we get viruses that we'll have every year that are prominent or become prominent when the temperature kind of changes or the seasons kind of change. So which viruses do we need to be worried about during winter versus summer months? And of course, what are these specific viruses that cause our common illnesses?
Okay, so in winter, the viruses we all know about are obviously influenza, the flu virus. Then there's also RSV, which is respiratory syncytial virus. That's quite serious in younger kids, but also in older people. And I mean, SARS-CoV-2, we don't know yet if it's going to be seasonal or if it's going to circulate regardless of the season, regardless of the temperature. And then things like measles, for example, when we do have outbreaks, it's not necessarily linked to a season. It can happen whenever. Things like rabies as well, it's not necessarily linked to a season. So I think in general, in winter, why certain viruses do circulate preferentially, it's in part linked to human behavior. So for example, now that it's cold, we don't really want to be outside. We want to be huddled up inside, cozy with our blankets, with our families. Even, for example, in offices, in schools, we don't want to have our windows open. We want to keep them closed so that everything is nice and warm and toasty. And that just presents a kind of more favorable environment for viral transmission, for example, for flu. But in all honesty, people can get flu in summer months as well. People can get RSV in summer months as well. It's not necessarily that, the virus survives or is happier in colder conditions. It's also heavily linked to how we behave.
So I want to contrast two viruses here, since we're speaking about viruses today, and how the spread is different in two. So maybe explain the difference between, for instance, the spread in an influenza virus and then the HIV virus, and why there were different modes of spread.
Okay, so influenza, right? It spread similar to SARS-CoV-2 through respiratory droplets. So if somebody is infected, while they're breathing out little droplets that have virus attached to them. Also, if somebody sneezes or coughs, then they have influenza, and the viral particles and droplets land on their computer or their door handle or their desk or whatever it is that they've sneezed on. And someone else comes along and breathes in the same space that they've been breathing, so breathing in those particles, or touches their computer that has all these virus particles coated on it, and then rubs their eye or scratches their nose, sucks their finger, whatever the case is. That's how, for example, influenza would be transmitted from one person to another person. Mm-hmm. But HIV, that virus is really only transmitted through bodily fluids. So if somebody has HIV and they come stand next to you, you're not going to get HIV. They can't give you a hug, they touch you, you're not going to get HIV. It's where there's an exchange. So, for example, during sexual activity, there's an exchange of body fluids. If somebody has an open wound or a gash or a scratch where their blood is open and exposed, and somebody else who has HIV, somehow there's an accident and some blood fluids are exchanged, that's how you get HIV transmission. Same as if, for example, back way back before we even knew about HIV and people were donating blood and we didn't even know that we needed to test for HIV. When you were then transfusing that blood into other people, you were giving them HIV. So that's, for example, how those two viruses differ in their modes of transmission.
Well, look, we're going to continue our discussion around viruses. Of course, we're going to look at the monkeypox virus and how that, of course, has come about in South Africa with the cases that we do have. And, of course, I think you'll explain very well the idea of how that spread and how that comes about and everything we need to know about monkeypox. But we continue the discussion, of course, after the break with Dr. Janelle Beeman, who is a scientific project manager at the National Institute of Communicable Diseases, about the importance of viruses, what they do, what they are, and, of course, the importance of how we can prevent getting that. Remember, you can be part of the show by asking any question that you have in your mind on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. Stay with us. Preventing the spread of COVID-19 as well as many other diseases is as simple as thorough hand washing. Now, we are South Africans in Johannesburg. The hygiene lessons that they learned from COVID-19.
Hygiene is humanity's biggest problem because some does it, some don't do it. But during COVID, I've learned, not that I've never done it, but the increased washing of my hands, taking care of my distance, personal hygiene, frequently sanitizing, stuff like that.
The biggest lessons I've learned about hygiene throughout COVID is just keep yourself sanitized, make sure those germs are gone.
I've learned to wipe surfaces before touching them and always wear your mask.
I learned that you should sanitize your hands regularly and that you should avoid touching certain surfaces, and that, what else? Wearing a mask, I guess, was part of a precaution to keep yourself safe from COVID, and social distancing in general. But I guess all of that is gone now, so that.
According to the World Health Organization and WaterAid, hands are the principal carriers of disease-causing germs. Only 1 in 5 people globally wash their hands with soap after going to the bathroom. Now, we continue our discussion with Dr. Janelle Beeman, who is a scientific project manager at the National Institute of Communicable Diseases, about understanding the importance of hand washing with the soap as an effective way and an affordable way to prevent diseases. Now, Doc, before we went to the ad break, I said that we would speak about the monkeypox virus, something that a lot of people have heard about of late and has caused a bit of anxiety. People think that, oh my goodness, we're going back to another lockdown. So let's talk about monkeypox, what it is and how one can actually get monkeypox.
Okay, so monkeypox is a very similar virus to smallpox, which I think we all know about. But the good thing is that it's not as bad as smallpox. We've had about more than 10,000 cases globally and only 3 deaths. So it's something that's a lot more manageable. The other good thing is that it's not as contagious as COVID or SARS-CoV-2. You can really only get it through contact with somebody who has monkeypox, close physical contact. So touching somebody who has monkeypox, especially if they've got the rash, that's kind of easy to see. Those rash blisters actually have very high viral load in them. So touching them, and then you rub your eyes and whatever, and then that's how you get the monkeypox. But luckily, it's not as fatal and it's not as scary as smallpox. It's also not as contagious as COVID. So I think it will be something that will be a lot more manageable. And when you do get monkeypox, it's not like you have to have some extensive therapy or treatment. You honestly just treat the symptoms. Get your calamine lotion. If you've got a fever or some pain, you get some pain medication. There's no really specific treatments for monkeypox. Most of what doctors are using for severe cases are drugs that were developed for smallpox. So obviously, most people who will get monkeypox can just treat it at home and recover within 1 to 2 weeks.
So who's more at risk of getting monkeypox? Are there groups that are more susceptible to getting monkeypox, or is it just a contagious disease from contact?
It is just a contagious disease from contact. It's early days. It's very difficult to identify high-risk groups when numbers are small. But there does seem to be some association with sexual interaction and with men who have sex with men. But like I say, it's very early days. There are people who have got it just through regular contact with somebody who has had monkeypox. So it's not solely a sexually transmitted disease. And so that's the kind of early warning indications or early indications. But like I say, very small numbers make it difficult to define high-risk groups at this point.
Now, we've spoken about viruses this morning, really highlighting how the viruses spread. And a lot of the time it's through contact. So people touching surfaces, people touching people that have this virus and then inoculating themselves with that virus themselves. So let's speak around this idea of preventing getting a virus by washing your hands. Seems like a simple idea, but take us through why it's so important to wash our hands specifically with soap.
Okay, so soap is a detergent, right? So when you wash your hands, you see those bubbles forming. And that actual detergent factor of soap, that detergent component of soap, is what can actually physically disrupt a viral particle. And not only viruses, also bacterial particles, bacteria, which are a little bit bigger. The soap molecules actually disrupt the physical virus. And so that's why it's really important. Like, in a sense, then you disrupting that virus particle, whether it's a viral membrane, whether it's a viral kind of coating, the coating around the virus, whatever it is, you're disrupting that and you're actually damaging the virus. And that's why it's really important to include soap. So in addition, just washing your hands and having running water, flow over your hands, that increases any particles that are on your hands, increases the chance of the particle washing off your hand. But yeah, the importance of soap is obviously to actually physically break up those viral or bacterial particles.
How can we increase the habitual nature of washing hands? I think we're all taught as children to, once you go to the toilet, you need to wash your hands. But this idea of using soap or using an alcohol-based sort of sanitizer, whatever it might be, to use after you wash your hands, how can we increase people getting into the habit of doing that?
Honestly, I think it starts, as we're kids. And us as parents, kind of not really drumming it in, but just setting the example. So us ourselves consciously thinking about it and reminding ourselves whenever we've been touching something, to just go in and wash our hands. If we've been out and we come home, make it a habit. As soon as you get home, wash your hands. Before you work with food, wash your hands. I think, obviously the masks really helped because, I think subconsciously we're all touching our faces. We always just maybe got a little itch here or whatever the case is. And so the masks really helped in that regard. But, going forward, if your hand is clean and you scratch your eye or whatever the case is, then you're going to limit the chance of inoculating yourself, as you said, if you touched something that had been contaminated with a virus. So I think it's more about just building habits, being intentional and thinking about exactly when it is that I want to wash my hands. So I want to wash my hands, like you say, after I use the toilet. Definitely, that should be a habit. I want to wash my hands before working with food. When I come home after work or after school, I want to wash my hands. And then as parents and as elders, setting the example for the younger kids, that's really going to be the only way in which we can build those habits.
Well, look, I think, hand washing is such an important thing. And of course, it becomes a little bit trickier for those that don't necessarily have access to running water or detergents when they have to do the basics like hand washing. And I think you could answer that question a bit later on. But we do have a caller on the line right now who's got a question that's related to viruses. Good day. Thank you so much for calling, Anonymous. Hi,
Hello,
Anonymous.
hi. Hello, how are you?
Very well. How are you?
I'm fine. Can I ask the doctor, after your husband is HIV positive and then I'm not positive, I'm negative, and then now we want to start a family, and then how are we going to do that? We want to have a kid.
Sorry, I'm struggling to hear you. Maybe slow down your question so that we can hear you clearly and move away slightly from your phone so we can hear your question clearly. Please say that again.
Okay, I said I'm married to my husband. He's HIV positive, and then I'm not. And then now we want to have kids. And then is it possible for us to have kids and then or not? Because he's HIV positive and I'm negative. Can we have kids?
Okay. So if I'm understanding your question properly, just correct me if I'm wrong. You are saying you're HIV negative, your husband is HIV positive, and you guys want to have kids. So you want to establish what exactly?
Yeah, I want to know if can we have kids without
Without infecting each other, I'm assuming.
Yes.
All right, lovely. All right, Doc, let me throw that one to you. HIV positive patient, as well as there being a partner who's HIV negative. They want to have kids and obviously want the child not to have HIV and also the negative partner not to have HIV. How do we manage this?
So actually, it is possible. Thankfully, through antiretroviral therapy development, it is totally possible. So what you would, if I remember correctly, you were HIV negative.
Yes.
So what you would have to do as the HIV negative partner is you would have to take antiretroviral therapy, obviously before you get pregnant and while you're trying to get pregnant. And then when you get pregnant, you will still have to keep testing and monitoring. And your husband obviously will also have to be on ARVs just to make sure that his virus is suppressed, even if you weren't trying to have a baby. It's a very good idea for anybody who's HIV positive to make sure that they're on therapy. If their virus is suppressed, it means they can live longer. It means they're healthier for longer. But you as a woman who wants to have a baby with your husband, that is completely possible. I would definitely recommend, though, I'm not a clinician, I'm not a doctor. So I would definitely recommend that you speak to your healthcare provider, whether it's at a clinic or your own family doctor. But like I say, it's definitely possible. You just have to take antiretroviral therapy as prevention, basically. And then they will monitor you through the pregnancy, and they will also monitor the baby. And yeah, definitely possible.
Lovely. Thank you so much, Dr. Janelle Beeman, for joining us today, Scientific Project Manager at the National Institute of Communicable Diseases. And of course, to you, Anonymous, go out, go see your doctor. They'll guide you specifically about what to do, what treatment to take, because it is possible without you getting infected yourself, even if your partner is infected. After the break, we'll speak to Dr. Leslie Bamford, a child health specialist from the National Department of Health, about the Government Gazette on the changes in COVID regulations and what this means for our health. Stay with us. Welcome back to Vital Signs. Health Minister Dr. Joe Phaahla gazetted a new regulation which allows South Africans to be mask-free in taxis and shops. Now, this follows a decline in COVID-19 reported cases, hospitalizations and reported deaths. We're joined now by Dr. Leslie Bamford, a child health specialist from the National Department of Health, about the Government Gazette on the changes in COVID-19 regulations and what this means for our health. Thank you so much for joining us, Dr. Bamford. Nice to see you again.
Good morning, and good morning to the viewers.
Good. So let's speak about what the Minister has said with respect to the announcement. Before we get to the Government Gazette, this idea of monkeypox. Now, June was a month where some of the cases were being outlined and, of course, being announced. What does this mean in terms of the monkeypox, in terms of an outbreak in the country?
Well, obviously, globally, there are concerns around the increase in the number of monkeypox cases, and we have had a very small number of cases in South Africa. I think at this stage, it's a situation that we really need to monitor closely, and make sure that cases are identified, and where cases are identified, their close contacts are followed up. But it's not, I think the timing was unfortunate. It was just as we were coming out of COVID that there were these cases of monkeypox, and I think people feared that monkeypox was going to become like COVID. Currently, there are really no signs of that. Obviously, we can't see into the future, and we need to take necessary precautions. But for now, the situation appears to be under control, and we will have to monitor and wait and see.
Now, based on all of this and the numbers that we currently have, I think the number is currently sitting at 3 at the moment. Do we need to find ourselves being more alert to what monkeypox is, how it's spread, and how can we prevent ourselves from getting monkeypox?
So monkeypox is spread by close contact. So I think the most important intervention currently is for people who are unwell, who have skin changes that might look, if they're concerned about monkeypox, that they present to a health facility, and that our healthcare workers are vigilant and are able to diagnose and report and respond to any cases. I think really it's more important for people to stick to the basics. Your previous speaker spoke very eloquently about the importance of hand washing and general hygienic practices. So we no longer have to wear masks. People who are comfortable wearing masks, we would still encourage them to do so, particularly in higher risk settings. But certainly mask wearing is no longer a mandatory. But we need to implement the lessons we learned during COVID. And probably the most important one is the importance of hand washing for preventing many diseases. The other thing we learned through COVID was the importance of vaccination. And there are vaccines against a number of viral diseases, including measles, polio, influenza, HPV. And so it's important that people do check their immunization status and have all the vaccines that they are eligible to receive, both for themselves as adults and particularly important to check the immunization status of their children.
So let's speak about vaccines. Is there a monkeypox vaccine specifically? Is there something that would be available? And maybe then let's talk about the idea of the smallpox vaccine rather, and how effective it's been against monkeypox.
So it does appear that the smallpox vaccine does provide protection against monkeypox. So, of course, those of us who are a bit older, like myself, as children, we were immunized against smallpox. but once smallpox was eradicated very early in the 1970s, smallpox vaccination was stopped. And that possibly has allowed monkeypox now to the resurgence of monkeypox. So there are small stocks of smallpox vaccine, and there is a monkeypox vaccine that is under development, but these are not currently available in South Africa. And I think, again, we need to focus on the basics. So there are many cases of influenza. Influenza kills many people in South Africa every year. We have an effective vaccine that is available, that people can access. And really, it's more important for people to be accessing the available vaccines that protect us against common conditions, rather than at this stage worrying about monkeypox and availability of vaccines. Certainly, if we would need to monitor the situation, and there may become a point where people should be vaccinated against monkeypox, but we certainly aren't there. And so, as I say, I think it's more important for people to stick to the basics, protect themselves against common diseases like influenza, to protect their children against viral diseases that are not common at the moment because of immunization. Diseases such as measles or polio. But if we do not protect our children against these conditions, there is always a danger that there will be outbreaks.
Keeping updated to vaccines is an important thing, I think you've highlighted, specifically for children. But who is at risk of getting diseases and who should be taking vaccines? I think I say this because it aligns to the influenza that you spoke about a little bit earlier on. So are there groups that are more susceptible to getting diseases that may end their lives? And are they, or aren't there groups that are like that?
So it's a little bit of a mixed bag. Certainly with childhood vaccines, there are children who are more vulnerable. But the way that we protect or reduce how commonly these diseases occur is by vaccinating everyone. So when we vaccinate all children, we protect those individual children from the diseases, but we also protect others through herd immunity. So as more and more children are vaccinated, it becomes more difficult for the virus or the bacteria to be circulating, and that protects even others who are not vaccinated. So for example, one of the vaccines we give in our childhood program is a disease against pneumococcal disease. Now, children are at risk of pneumococcal disease, so it's good to protect them. But older people are also vulnerable to pneumococcal disease. And it has been shown that by vaccinating children, we also protect older persons against pneumococcal disease because in many cases, the older people acquire the infection from their grandchildren or other young children that they are in contact with.
So the idea of restrictions being removed, these of course being the COVID-19 restrictions with respect to the mask wearing and of course restrictions to gatherings and the number of people at events, is there benefit to removing these restrictions specifically for people and infection?
Well, I think government has always said that we're following a risk-adjusted strategy. So of course, the safest thing to do would be for us all to stay at home, never to go out, never to meet with anyone, not have any physical contact, no gatherings, wear masks all the time. But that's not acceptable in society. We are social creatures. We want to participate in large gatherings. Some people found it comfortable to wear masks. Other people really hated wearing masks. So I think our position is really that given the small number of cases, secondly, the small number of people being hospitalized, and thirdly, the high proportion of people who now have immunity to COVID through vaccination or through natural infection, that it is no longer reasonable to make mask wearing mandatory, preventing people from having social gatherings. So really moving from a situation where these things are legislated to a situation where people must take personal responsibility. So we would still recommend that people who are at high risk, older persons, people with comorbidities, that they consider wearing masks if they are in gatherings, that they still concern themselves around ventilation. So better to meet with other family members outside rather than inside. And that, of course, they make sure that they are up to date with their vaccinations. Because the risk is no longer, has not disappeared completely, but we need to move to the situation is currently under control. And I think it's really for those reasons that the restrictions have been lifted.
Thank you so much, Dr. Bamford, for joining us today, child health specialist from the National Department of Health, and really outlining all these principles that we're really discussing today, the idea of viruses, what they do, monkeypox, and of course the importance of the new change in regulations, mask wearing, and of course restrictions to gatherings, that the country is a little bit more open now, people can gather, but that we shouldn't throw all the regulations to the wayside and just continue to look after ourselves. Thank you so much to all the guests that joined us today, and more specifically, thank you to you for joining us and really putting your ear out to receive all this information so that when you gather with your friends, you're able to be a little bit more informative about this idea of viruses and how viruses are spread, and also playing a part to play safe and be safe and protect yourself. I'm Dr. Musa Mtomeni. Thank you for joining us. Do take care.